I was definitely depressed, down, not knowing the kind of the clinical earmarks of depression. I didn't recognize it, but other people did. And I think it's part of that male macho, I'm fine, I can handle it. And, but I did, through family, friends, my wife say, I do need help. Even my children said, Dad, you need some help. So I did go, and I have to admit somewhat reluctantly. But then, when it's laid out that it's a clinical problem, it's not about inner strength or masculinity or, your courage. It's just part of the human process, and the mind is just as much a part of the body as your organs, and it needs care too. I do have some hostility, anger, um, but not as much as many. I suppose it affects different people different ways. Um, there's, those that have the banner, why me? And I could never understand that. Why not? Um, Pardon the expression, but I think the more appropriate one is shit happens, you know. So, there is an anger, and and then there is a feeling of, you can feel sorry for yourself, but that's just not productive. And it happens though, and when you feel down, you feel sorry for yourself, or you do feel angry, you have to say, well, okay, I feel this way, but it'll pass, and I'll get going, or my wife will kick me out the door and keep me going. Um, so it is a part of the whole process of facing death closely, but I think it's one that you just have to live through. A good doctor will want to have you investigate every source possible. We started out in our local suburban hospital, but when I started getting these, very dire diagnoses and the surgeries, we wanted other opinions, second opinions, third opinions, as we rightly should have, and everyone should get. It's you owe it to yourselves as survivors to get the best medical care you can, and that means searching and looking and being proactive. This one particular doctor was unfortunately insulted that we wanted another opinion. He said he was giving us the best care available, and he worked for this large hospital in Washington, and on, and would not give us a referral to a large cancer center. So my wife called up our family physician who recommended him, and our family physician said, well, you don't want to get his nose out of joint. Well, my very mild-mannered, sweet wife, they were on the phone. I was sitting there, kind of stretched out on the couch, A string of words came out of her mouth I never heard before. And an hour later, we had a referral to the medical center. So you just sometimes, have to fight as hard as you can. My name is Chris Carley, and I'm an 8-year sarcoma cancer survivor.